So this brings us to the alarming reality of how our society actively undermines the mental health of young people. And our next speaker, David Wiss, will discuss how we can overcome the commercial determinants of adversity, such as predatory marketing, harmful industries, and inequitable policies that impact the most vulnerable who are falling through the cracks, often into the criminal justice system, rather than receiving the care and the resources that they need. So welcome, David. It's wonderful to have you with us.
Thank you so much, Susan. I'm going to talk today about the commercial determinants of health and adversity, specifically how ultra-processed foods link to mental health and criminal justice. You can find more at drdavidwiss.com. We've been studying the social determinants of health for many years now, and you all probably know these are the conditions where people are born, live, learn, work, play, worship, and age, all of which affect a wide range of health outcomes, well-being, quality of life. And now, in capitalistic societies, we need additional frameworks. Introducing the commercial determinants of health. This is an effort to understand how economic influences and incentives impact health worldwide. This can be defined as the systems, practices, and pathways through which commercial actors drive health and equity. I want to recommend the series from The Lancet last year on the commercial determinants of health. Really looks at how commercial actors shape political, structural, and cultural environments. And it's a framework that identifies the role of increasingly powerful transnational corporations that dominate unhealthy commodity industries such as tobacco, alcohol, and ultra-processed foods, which I will be talking about today. It is very clever how some of these often hidden forces are able to shape norms and amplify voices. It's not that they find people and pay them to say things. They find voices that are singing songs at nearby tunes, and they amplify them through media and think tanks and PR organizations. So we know that ultra-processed foods affect global health and personal, familial, community health. And I want to really celebrate Susan's artwork that connects the biology of the human experience with our natural environment, really starting to think about how dietary patterns affect our physiology and our brains and our preferences, particularly linked to the gut bacteria, chronic inflammation, immune dysregulation, and thinking about ultra-processed foods as not just a psychosocial, but biological risk factor. So we need to think about disadvantaged communities. Today, I'm going to talk about those with criminal justice involvement. Of course, we're thinking about ultra-processed foods in healthcare settings like hospitals, correctional facilities, and also in eating disorder treatment. Most of the data linking ultra-processed foods to mental health is with depression and depressive symptoms. But today, I'm going to talk about antisocial and aggressive behavior. There are some studies, mostly outside of the US. You could see a large data set here from Iran linking the frequency of ultra-processed foods with psychiatric distress, violence, bullying. And there are protective factors, carotenoids and fiber, inversely associated with aggression. Some pretty interesting correlational research, basically suggesting that there are some associations with food and aggressive behavior. For example, simple carbs, saturated fatty acids, and caffeine. So this now brings us to this idea that perhaps nutrition could be a risk factor for criminal justice involvement, as well as implicated in recidivism, and thereby a major unspoken tool of oppression in our society. So it's bringing the biology back into the question, whether it be early life stress, traumatic brain injury, and of course, chronic exposure to nutrient-poor diets. And it's not just the food, the added sugar, salts, and fats, but the additives, the nanoparticles, microplastics, et cetera, that can affect serotonin, dopamine. And we know a lot of these inflammatory processes can signal at the level of the blood-brain barrier. And we now have a term, leaky brain, which is important for the gut-brain connection. So nutritional criminology brings a lot of this work together, thinking about how dysbiosis connects to forensic and legal psychology, knowing that the gut microbiome is not only influenced by the host behavior, but the behavior of the host is also influenced by the microbiota. And we see that across a wide range of different behaviors and outcomes. So ultra processed foods have implications for criminal justice. There's an emerging field called neuro law, which challenges certain assumptions of free will and suggests that criminal responsibility and blameworthiness do not sit on an even plane. If you're interested in understanding some of the research linking diet to um, uh, prison systems, there is a recent systematic review. I want to introduce a concept that has really caught my attention that I want to call value-based eating. Dr. Bryan did a randomized controlled trial a couple years ago on 8th graders and attempted to frame healthy eating in a new way, as opposed to just talking about milligrams and ingredients, really thinking about eating as being consistent with values. So for example, 8th graders seeking autonomy from adult and the pursuit of social justice. So the education, and I've been implementing this in my individual and group practices, is really just offering people a way to take a stand against manipulative and unfair practices of the food industry. For example, engineering food to make it addictive and marketing it to young children. Compared with traditional health education, this treatment definitely showed improvement in 8th graders' eating behavior. So this is an effort to harness the motivational power of people and groups and to try to align healthy eating with values that people already care about. For example, feeling like a socially conscious person. We know that traditional nutrition education and self-regulation approaches are difficult, particularly for those with addictive disorders. And so this approach to nutrition education offers an immediate symbolic benefit for changing ways, feeling like a person that's acting in accordance with important values. And it's a framing intervention and it's effective. With our new data on ultra processed foods, we have ways to empower people to make choices that not only affect their health, but affect the health of the planet and help people live up to values that they might already care about, taking a stand against some of this injustice that is perpetuated by food marketers. I'm also trying to promote the idea of value-based eating in the eating disorder community, where there is a lot of contention about food. And I'm deeply trying to help make peace around some of these controversial discussions. My message in a nutshell, I believe nutritional deficiencies and the associated biological consequences should always be addressed before any new psychiatric diagnoses are made and medications are prescribed. I believe that nutrition is not alternative medicine and that corruption in healthcare must be stopped. And I'll meet you right there in the real world, free from conflicts of interest, justice-oriented, and forward-thinking. Happy to share slides and happy to keep in touch. Thank you so much.